Okay, today, first of all, my name is Cody. I am a paramedic student with OC, and today we are going to be showing you how to mix 1 milligram of glucagon with 2 mLs of sterile water and how to administer it for a adult or pediatric. Okay, so let's get started. First of all, be assessing safe, always, before handling any type of med or drug. Okay, first of all, we're going to check to make sure this vial has not been compromised in any type of way. The cap does not spin, it is on, and also this is out of date. The expiration date was February of 2004 of this year. This will not be administered on any human being or animal or child. It is going to be disregarded after this. Okay, so once we've checked the integrity and the sterility of this vial, we are going to break the cap. Remove the cap to expose the silicone seal on the top. This is where you are going to penetrate your 18 gauge draw needle on your 3 ml syringe. I am using NS on this syringe. I do not have sterile water. Your glucagon will come with sterile water whenever you pick it up from the hospital. Unfortunately, I was lucky in getting this one, but I was not fortunate in getting sterile water. So, okay, once you've drawn up your 2 mLs of sterile water, you will add your 18 gauge draw needle, and then you will safely remove your cap, set it down, and then very carefully penetrate your silicone seal with just enough force to safely apply the sterile water. And then you will administer into the vial. You may end up getting some back pressure. That's okay. Just make sure you hold your plunger. It should seal after the administration or spray at you. That's why we wear gloves. And then set your vial down, put your cap back on. Keep that, you are gonna need it. Make sure all your solution has been mixed. There are no clumps. And as you can see right there, any clumps or anything like that, you wanna make sure get absorbed to ensure the correct dosage on this whenever you draw it into your needle again. So we'll make sure that's good and mixed up. I do not see any clumps. Does look pretty thick with the solution. Okay, so then this thing is already pressured up. I did put on my outline that you want to administer 1 mLs of air. Usually these things have negative pressure in them, which will basically will suck the 2 mLs of sterile water into the vial. Now, indications for this are going to be hypoglycemia or a beta blocker overdose. This works really well. The beta blocker overdose is dosed at 3 to 10 milligrams. So you are going to need 3 of these vials and drawn up in with 2 mLs. I would do a 10 ml syringe, and it will be injected IVIO, not IM, like I'm going to show you today. So, in the place of that. So, solutions mixed up, we're going to remove our safety cover off of the needle. And since it is already pressurized, we're going to carefully repenetrate our silicone seal, flip your vial upside down, and start to pull on your plunger until all the contents has been removed from the vial. And you want to slowly withdraw your needle once it gets down. Okay. You might have a little air in there, that's okay. We will dispense the air, but you also want to pull some air back to make sure all your contents comes out of your needle. Alright, so then with that being said, we will remove our 18 gauge draw needle. And then I do not have one, but I am going to simulate this to be my 22 to 23 gauge IM needle. It is an 18 gauge draw needle again. I did have an extra one of those. Yeah. So we will remove the new needle while maintaining the sterile process. We will get that on there, and we will hold on to this. You will grab one of your alcohol prep pads. You will open it, and then normally we inject this into the left or right side delt. That is the preferred method of administration, but you can also administer this IVIO or sub-Q. If you do not have IV access or IO access, this is the preferred method. This is for quick access. Well, we'll talk about that after. Contraindications for this would be a pheochromocytoma, insulinoma, or known sensitivity to glucagon. That will be your contraindications. Usually we will administer this in place of somebody with altered mental status without IV access. If we have IV access, we are more than likely going to administer D50 with hypoglycemia. I'm going to say it again, with a beta blocker overdose, we are going to administer this IVIO for quick administration to stop the effects of the beta blocker. This cannot go IM to counteract the beta blocker. And total amount of mLs to inject into the side delts will be 2 mLs for your side delts. Infants, we cannot inject into the side delts. The preferred method will be in the thigh, or we'll say the thigh. It can hold up to 2 mLs, but we like to divide it 1 ml in each thigh. So, okay, so we will talk about this. You will take your alcohol prep pad, you will prep your site, you will take your 23 gauge draw needle, basically remove it. I'm not going to remove it because I am not going to administer this into myself, especially not with an 18 gauge draw needle. That will hurt very badly. But basically you will want to find your delt site. Usually I find the ball joint from right here of your shoulder, and then I will take it down 3 to 4 spots. My arm's a little bit bigger, and then you will feel that squishy material. You want to use a 22 gauge to a 23 gauge IM needle. That's usually about 1 to 1.5 inch in length. And then after administration of this, you want to dispose of this in your, we're going to pretend this is my sharps container. Contents and everything. Okay, that didn't fit, but anyway, you will dispense of this into your sharps container immediately after administration. You will take your alcohol prep pad, keep applying pressure until you can get a band-aid or until bleeding stops. You will also, this is glucagon. If anything, you can keep this vial and put it in your pocket to show administration. It is not a narcotic, so no proper paperwork needs to be performed on that, but it does need to be documented of the administration. Excuse me. And then you will reassess your patient, your blood glucose. You will recheck that or check mental status. Another issue with this is if the patient does not have, the action of this converts glycogen to glucose. So if they are deprived of glycogen, this will not work. This is contraindicated for anybody that is deprived of any glycogen. So, well, thank you for your time. I hope y'all enjoy this video. Stay classy.